put it on and it's click on it. Is it showing now?
And not yet, or maybe we can proceed as you check on the camera.
Okay, sir. Thank you.
Thank you.
Yeah, so we will proceed. As we said, yeah. Okay. Yeah, so sexually transmitted infections, these are infections which develop as a result of contact with a person who has this disease through sexual contact. So if one has sexual contact with somebody who has any of these diseases, then it'll get infected and this will form sexually transmitted infections. Of course, there are many modes of transmission. The commonest is through vaginal sex. Of course, as things change now, we'll see more and more of those who have anal sex, oral sex, skin-to-skin contact. And for mothers who have some of the sexually transmitted infections, they can be transmitted to their babies during pregnancy and birth. Yeah, so those are the main modes of transmission through sexual contact, through the various forms that I have listed. Of course, the next question before even we go into specific ones, these infections can be treated. They can be treated through various drugs. If they are bacterial infections, they can be treated with antibiotics. If it's viral, some can be treated through antivirals. Some have vaccines, as we shall see. Okay. So, like we said, the main mode of spread is through sexual contact, through the modes which I've evaluated, and through some through mother-to-child transmission during pregnancy and delivery. The signs and symptoms of these infections really depend on which particular infection one is dealing with. But in general terms, most of them, like the bacterial infections, will present with abnormal vaginal discharge or penile discharge for men. Some could be to an uncomfortable topic, but it's there through rectal pain, rectal discharge. We see patients with sore throat, for men, swelling and pain in the testicles. And if these are treated, then they lead to long-term complications like infertility for both the ladies and the men, infection of the uterus and the tubes for the ladies with chronic low abdominal pains. Some of them will lead to a blockage of the fallopian tubes in females if the infections are not treated properly. So the commonest, by far the commonest sexually transmitted infection is gonorrhea. That's the one Munene alluded to. So the transmission can be through any of the sexual modes we have alluded to, or even during pregnancy and childbirth. And what are the symptoms of gonorrhea? How will one know? In the early stages, it might not present much, but later it will present with an abnormal vaginal discharge, or for men, a urethral discharge, which can be whitish yellow or green with a lot of burning sensation. If the infection spreads, then for men, it will cause a pain within the testicles, pain when passing urine. For women, the same. If it continues and then gets into the urinary tract. They'll have pain when passing urine, some whitish, yellowish vaginal discharge, and sometimes there can be a vaginal swelling for the ladies, what we call a Bartholin's abscess, and for the men, they'll have pain and swelling in the testicles. If this is not treated, it can lead to infertility for both genders. It can cause if it infects the tubes for the ladies, it can cause blockage. Even for the men, the ducts, the tubes that carry semen from the glands can block and lead to azoospermia, what we call a zero sperm count. If not treated, it can cause, it can go all the way if it gets into the blood system to cause rashes, fevers, and even conditions like meningitis. Of course, for those who get a throat gonorrhea, they'll have a lot of sore throat, which is very, very painful and does not respond easily to antibiotics. Okay, so that is for gonorrhea. The next, before I leave that, is a topic of supergonorrhea that has been trending. That came as a result of the research that was carried out in Cambridge. Why they called it supergonorrhea is because it was not responding to the common antibiotics that we use to treat gonorrhea. Most of the disease would respond to common drugs like the penicillins or doxycycline, but this supergonorrhea is a strain that is resistant to most antibiotics. And it's because people have used and mixed many of these antibiotics or used without completing the dosages. So the bacteria with time becomes resistant. And as it spreads, it becomes a problem because even if we give them the usual antibiotics, it does not respond until when we take a pus swab, a sample, take it to the lab, then we work out which antibiotics it responds to. And most of the times it ends up being the very expensive antibiotics. Okay. So that is as far as gonorrhea is concerned. So it can affect both women and men, as we have seen. The next common one is syphilis, which is a very old bacterial sexually transmitted disease. Can also be spread through direct sexual contact and through mother-to-child transmission. It begins, for the symptoms, syphilis begins as an ulcer around the genital areas, which is not painless, but does not heal. And then, as if the disease is not treated, then one can have a spread of those ulcerations through other body parts. The strange thing with this, if it's not treated, it can regress, but one doesn't see those ulcers, but the disease is going on to, and it will progress to a more complicated form, which we call secondary syphilis. And this is what one will have. If you can see those pictures, one will develop rashes throughout the body and in the palms, even in the head with the hair, even in the tongue or the vaginal walls will develop the ulcers. This is now a secondary syphilis. And if it's not treated, actually progresses to tertiary syphilis, which involves the brain, and it can interfere with the mental faculties of somebody. So it's a very severe infection, and we do screen all pregnant mothers for this one because it can have severe consequences if there is transmission from the mother to the baby. So if one has genital ulcers that are there and are not healing, they start spreading, they don't respond to the usual cleans, please have it checked. It could be syphilis so that it can be treated before it goes into the severe forms. Okay, so that's what happens for the if syphilis is not treated, it can affect the heart, like I said, it can affect the brain, it can affect the bones, the spine, basically all organs of the body. We don't see this as much because of advanced treatment, but this was especially seen in the USA during the era of slavery, where they exposed blacks to no treatment so that they could see what happens in the long term. And they used to see the terrible pictures like you can see. So blacks were subjected to no treatment so that you can see that they could be able to see the full extent of the illness over time, which of course was extremely cruel and a violation of their human rights. Okay, that is still a continuation of the same of, if syphilis goes to the brain, it will cause all that paralysis, blindness, it can cause mental disorders and can result to death if it's not treated in good time. Okay, that is what happens if syphilis affects the baby while in utero before birth. The baby can be born prematurely. The baby can have birth defects. The baby can end up with bone problems, and even after birth, developmental problems because of the effects on the brain. So it can be that severe. That is why all mothers are screened for syphilis, because if we miss it, then these are the consequences one will get. Okay. So that is for syphilis. I'm going through an overview so that we can later have a detailed discussion. The other common infection is, just a minute. So that is syphilis. Yeah, so this is a sexually transmitted infection. Basically, more affects the ladies more than the men. It's called trichomonas. Trichomonas is a parasite that one can get from an infected person, and it infects the vaginal walls and the cervix. And what happens then, the person develops a yellowish, greenish, very foul smelling discharge with a fishy smell. And they'll have, apart from that abnormal discharge, they can have a lot of pain during urination. It can cause a lot of itching, and severe ones can even get into abnormal vaginal bleeding. It tends to affect the lower reproductive tract more than the upper ones. And because it creates ulcers within the organs, then the person is still prone to develop other infections at the same time. So when one notices these abnormal discharges, it can be treated. The treatment is fairly easy with antibiotics, with simple antibiotics like the Flagyl, which people do take sometimes when they have an abdominal upset. And this is able to take care of, the infection. Okay. Okay, let's go to the next one. So that is trichomoniasis, which is fairly common. Sorry, that one skipped a bit. This one I wanted to highlight. It went off the screen, but before we get into pelvic inflammatory disease, there is also one of the commonest sexually transmitted infections is called chlamydia. It's a bacterial infection, presents just like gonorrhea, with a yellowish, foul-smelling discharge. It will cause burning sensation on passing urine. It will cause testicular pain for men and pain when passing urine. And it is easily passed from one person to another. It's also fairly easy to treat. When we get it, we can be able to treat it with antibiotics. So then I go to pelvic inflammatory infections are when the sexually transmitted infections ascend, they go up to affect the uterus, the tubes, and the ovaries. And commonly they cause a lot of low abdominal pain, especially for the women. They can cause a burning effect when passing urine, an abnormal vaginal discharge. They can lead to abnormal bleeding in between periods. And if it continues, it can even include a fever. Long-term effects, mostly it destroys the tubes, leading to infertility later in pregnancy, or even to ectopic pregnancy if it affects the lining of the fallopian tubes. If it's not treated, it leads to chronic or long-term lower abdominal pain, what we call chronic pelvic pain. And this one calls for aggressive treatment because of these severe symptoms. When one has this persistent lower abdominal pains, they should be assessed so that they are treated as appropriate. Therefore, that way we will avoid this damage that occurs to the tubes, leading to infertility or risking one to get ectopic pregnancies. Okay, I would like to skip that. So the other common one I would like to talk about is human papillomavirus, which is a viral infection, and it's one of the commonest sexually transmitted infections. Why it is important is because human papillomavirus, or HPV, is known to be the cause of cervical cancer, vulval cancer, and penile cancer, and anorectal cancer. But more commonly, the one we are very, very sure of and is common in our setup is cervical cancer. So it's a sexually transmitted infection, does not have any symptoms or signs. There is no active treatment for HPV, but if one has persistent HPV infections, then it can cause complications. For the non-cancerous types of HPV, it causes anogenital warts. You have rashes that can grow into very big growths around the genital areas. For the ones that cause cancer, it causes changes in the cervix that later lead to development of cervical cancer. The good thing with this one, though there is no treatment, is now that there is a vaccine for the same, the vaccine for cervical cancer, which is given to women and even men from age of 10 before they are exposed to sexual contact and infection with this HPV virus. And also for women, there is now screening for cervical cancer. We screen for the changes of HPV through the various tests like pap smears, and also there is HPV test, which is now offered in many facilities, so that those who have HPV, then we are able to follow them up closely to make sure they don't progress to develop cervical cancer. So for women, it's important to know the vaccine is available. For those who have young girls who are between the ages of 10 to 15, the vaccine is given in all vaccination centers, all government health institutions, and it's given free of charge. For the older ones, if you have to buy the vaccine, it goes to about, there are two types. The cost is between 4,000 to 11,000 in most facilities for those who are above 15 years of age. The free ones are only available for those from age 10 to 15. And that age was just basically a piloting age to see the acceptance of this vaccine in our population. But the vaccine has been in usage for many, many years in Europe and the Americas, and it's very, very safe. And it's one of the weapons which We are now insisting on to reduce the cases of cervical cancer, which is the commonest cancer that kills women in our setup. But fortunately, we can prevent, but the uptake is very low. So take note of that. The next one is hepatitis. Hepatitis is a virus which affects mainly the liver, but it can be, especially hepatitis C. Hepatitis B can be transmitted through sexual transmission, then it goes to affect the liver. Okay. So of course, the other common infection is HIV. As we all know, it has not gone away. The prevalence is still very high, and studies are showing the prevalence of newly acquired HIV infections, especially among the young people, is increasing. As we know, once one gets it, it's a chronic lifelong infection that one has to ensure the immunity is not affected as such. So we still need to employ the measures to prevent new infections with HPV and ensure those of HIV and ensure those who have it have access to treatment, which fortunately is free in all our government facilities. So I'll end there so that we can have a discussion. I didn't want to make it very complicated because then that will, it can be a bit difficult. Now we can have a discussion at individual level. We see what we can be able to share. Thank you. Munene, back to you.
Thank you, Doc. Thank you for that informative session. I'm not sure if you're able to see the Q&A section. There's a question from one of our attendees.
Yes, from Catherine.
Yes.
She says she's curious if a urinalysis result shows no infection. Does this mean there is no presence of STIs like gonorrhea and syphilis, or must this test be done after urinalysis? And how often should a patient screen for sexually transmitted infections as a good practice? Thank you, Catherine. This is a very good question. Most times, these sexually transmitted infections will not show in the urine unless they are very advanced. So you can have a urine test and it will be normal, yet one still has a problem. What should be done is what we call a vaginal swab. A cotton swab, something, a small matchbox like stick with cotton wool is passed into the vaginal canal, or for men into the penile urethra, and that discharge from those areas is taken for analysis. That's the only way of picking whether one has a sexually transmitted infection or not, especially for gonorrhea and chlamydia. For syphilis, it is a blood test that is done called VDRL or TPHN. So urine tests will only show if these particular infections have gone to the urinary tract, which tends not to be very common. Now, in terms of screening, for sexually transmitted infections, one should screen if they have an abnormal discharge. Two, if they have had sexual contact with a person they're not very conversant with, and that sometimes does happen, and they suspect the person could be infected, or even if the person is not infected, it's good to screen, or a partner who has an infection, then the other partner should go for screening. Now, for the viral infection, like for HPV, at least one should do the HPV test once a year. And on top of that, we recommend you do the pap smears. That is to screen for changes that can put one at risk for cervical cancer at least once a year. So I hope I've answered Catherine clearly. So, and then the next question from Salex, does a cloudy penile discharge a symptom for gonorrhea? Yes, it could be. It needs to be tested and one gets treated it's definitely not normal. It should be both tested and treated as appropriate. Okay. Let me screen for more questions.
Doc, there is another question about the super gonorrhea. One of the anonymous attendees is requesting that you briefly give highlights on the symptoms and why is it rampant in Nairobi rather than other parts of the country?
Yes, the super gonorrhea, like I said, what it basically means is that it's a multi-drug resistant. That is, if one is infected, then it does not respond to the common drugs or antibiotics that we do use for treating gonorrhea. Either because of misuse of antibiotics or the bacteria has evolved to survive, so it has learned how to dodge the effect of the common antibacterial drugs. The symptoms, like I said, for that would be, for females, an abnormal yellowish mucoid discharge. They'll have a burning sensation, a burning vaginal sensation, burning effect on passing urine. Some will have a swelling in the outer, in the vulvar part, the outer vaginal part, meaning it has infected the gland and is forming a boil or an abscess, as we would call it. Yes, and for men, it will still give whitish, creamish, yellowish, penile urethral discharge, pain when passing urine, and swelling or pain in the testicles for men. And now, in terms of treatment, we have got to take those swabs, take it to the lab, and be able to see which antibiotics is this super gonorrhea sensitive to, because the ordinary antibiotics wouldn't be effective in treating the same. I hope that suffices for super gonorrhea. So what are the side effects of taking the vaccine? I presume we are talking about the HPV vaccine, which is very important in prevention of cervical cancer, which is the biggest threat to women in terms of cancer as we talk. So the side effects are really minimal. Initially, it would be pain at the site of injection because it's an injection. One can develop a slight fever and muscle pains, maybe some 6 hours after the injection, which goes away on just taking the kawaida Panadols. The rare side effect is if one develops allergy to the vaccine, then it can cause a severe reaction, which is true even for the other drugs. Long-term, not much of side effects. It does not cause infertility, which is the biggest fear in many people. It does not cause neurological effects. I know that there are those who might read from the internet about how it is causing neurological effects in children later in life, which is not true. It has been researched even from our own medical research institute at Cambridge and found to be safe. So the advantages far outweigh any potential side effects from the vaccine. So the reassurance is that the HPV vaccine, which is the vaccine for cervical cancer, is safe, very, very safe for our children, for young girls, safe for our adult women, and even for men who should actually even take, so that we break the cycle of HPV, which is the culprit that results into cervical cancer, which is a common problem in our setup. Is there a correlation between STDs and urinary infection? Yes, there is, because if, say, gonorrhea, chlamydia, and all these other infections get into the urinary system, which, by the way, is a different tract from the reproductive system, but they are close together. If this if these organisms get into the urinary symptoms, then they cause urinary tract infections. But it's possible to have a urinary tract infection that is not necessarily a sexually transmitted infection, especially in women where the urethra is short, so they are prone to have a bit more of recurrent urinary tract infections that are not necessarily sexually transmitted infections. So there's a correlation, yes. Can one get HPV vaccine after starting to engage in sex if they test negative for it? Yes, one can get. The best time is before, but even those who have beyond this age that we are talking about, they can get the vaccine. The age of 10 to 15 was just a small group the government selected to be able to pilot the vaccine. And that's what the donors who give the vaccine to the government could manage. But even older women can get what we call catch-up vaccine. It is safe to give up to around age 45, 50, so long as one does not have cervical cancer, can benefit from the HPV vaccine. And it's something we are seriously advocating for. Okay, let me see the other questions.
Maybe, Doc, in terms of the age of 45 to 50, how do you advise our audience in terms of maybe getting the vaccination or getting a way of preventing the disease, or rather the progression of either the HPV or catching the cervical cancer?
Yes, for the older women, what we advise is first, it would be ideally if we do screening. We'd screen for HPV and also we screen for cervical cancer, so that if one does not have cervical cancer, then they can still benefit from the vaccine, because it will be useless if you gave it to somebody who already has the cancer. So it would be good to do those screenings for the pap smear sometimes. But even those who have HPV infection, there is still a benefit of getting the vaccine. Because what the vaccine does is to stimulate your body to develop antibodies, defense mechanisms of wiping away the HPV infection. Remember, not everybody who gets the HPV infection will develop cancer. Majority, 80%, the body clears the infection from the body without any treatment. So it's only a small percentage whose immunity is not good, or who have the high risk types of HPV, who go on to develop cancer. So even those ones, they can benefit from the vaccine.
Thank you for that. There's another question, and seeing two of them. That is from Flora. She's asking, how do you treat PID in children? And then in the same question, maybe you can talk about how is HPV affecting kids?
So how do you treat PID? Should not occur in children because it's a sexually transmitted infection, and ideally children should not engage in sexual practices. Of course, we know the reverse could be true in quite a significant proportion of cases, because I think with our laws, anybody who is 18, is below 18 is considered as a child and is not old enough to have consensual sex. So children, as it were, if you find a child, say, who is below 10 years with this sexually transmitted infection, then you should investigate for sexual abuse of these children. But where those who have been abused get this infection, then they are treated with antibiotics. They're treated with antibiotics on top of investigating the circumstances around how they acquired the sexually transmitted infection. And yeah, of course, for the teenagers and older women and men, of course, you treat them with antibiotics as per the investigations. On the question of HPV and children, the idea of giving children, starting to give the vaccine from age 10 and above, and by the way, in developed countries, they give both boys and girls. They are given at that age because vaccines work best if they are given before one is exposed to the infection. That's why we give the measles vaccine to babies, so that later if they have the infection, they have enough body defense to fight off the infection. So similarly for HPV, we advocate giving the vaccine from age 10 before these young children are exposed to sex, and therefore before they are exposed to HPV infection. That is why the vaccine is given from that early age. It's been shown it is very, very effective, up to over 98% effective if given that early. And later on, even if they get the HPV infection, the body is able to clear off the HPV infection very fast. So it's not that they are being given contraceptives like some people allege. The reasoning is you give the vaccine before one is exposed to HPV infection, and then the body is able to clear this infection. If at all they're exposed to the infection in future, you can be very sure the infection will be cleared before it causes any damage. Yes.
Thank you, Doc. There's another question, but even before we go to the next question, I want to appreciate one of our own, our client and our doctor, called Faustine James, who has chatted us that is enjoying listening from us in Sierra Leone.
Okay. Was
Faustine,
actually one of our students. Pass my regards.
Sure. So Faustine, if you want to maybe have a word, you can raise up your hand so that we can be able to give you a chance to speak. Now, Doc, there is a question about how do you treat a bad smell from vagina, especially especially during sexual intercourse?
Okay, good question. Yeah, if there's a bad smell, it could be a symptom of an ongoing infection, and the best way to treat it is one goes to the doctor and has a vaginal examination to rule out any of these problems, because if one has any of these infections, it will cause a bad smelling discharge, and that can manifest during intercourse. Therefore, anybody who is affected then should be able to go to the hospital. And then one is, we do an examination, a speculum examination. We look, then take a swab, take a specimen for analysis in the laboratory, so that if there is an infection, then we are able to treat. The other important point, ideally, if there is no infection, there's no foreign material, because some people even forget tampons. There ideally should not be a bad smell, because the vaginal canal is created in such a way that it is self-cleaning inside. On the inside, it's self-cleaning. One is supposed to clean the outside. But I'm aware there are people who market soaps and other chemicals for cleaning inside, which leads people to develop a lot of infections, because it alters the normal bacterial balance within the system, and the pH, the acidity, is reduced, and one is prone to develop more infections. So should there be somebody who experiences that problem of a bad smell, and it does happen, then it should be investigated, a doctor's examination, and take samples for laboratory analysis, then that is treated. The other common infection, which might not strictly be sexually transmitted, is candidiasis or yeast infection. And this is more common in women because of the delicate balance between the fungal elements and bacteria within the vaginal canal, which is sometimes altered. If one uses antibiotics, you kill the good bacteria, then the yeast elements tend to overgrow and cause a creamish, cuddy with particles discharge that causes a lot of vaginal and vulval itching. And this is actually one of the commonest presentations in outpatient clinics from women, the candidiasis, because of the reasons I've alluded to. It's not necessarily a sexually transmitted infection. So it gives a creamish, cuddy, meshikana like mala, and it's a big bother, and it should be treated. What we do to try and minimize this is if one is treated with antibiotics for something else, then one should be given drugs to prevent this fungal infection. One should remind the practitioners, if they don't remember, that they should use together with an antifungal agent. And that's why one should avoid cleaning inside, because ideally it should be self-cleaning. Yeah, I hope I've answered that well.
Thank you, Daktari. Someone is asking, good morning, Daktari. What is the difference between STI and UTI? And maybe you can combine that one with a question that is coming up. For latent syphilis with no signs and symptoms, how long does it take, and how can one get an early diagnosis for the same?
Yeah, STI and UTI. UTI means urinary tract infection. So that is an infection from the bladder to the urethra. That is the passage of urine to the outside. It could also extend to infection of the tube that brings urine from the kidneys to the urinary bladder. But sexually transmitted infection is an infection within the sexual tract, the vaginal canal, the uterus, and the tubes. And for men, it could be, it can be, for men, it tends to be more or less combined, because it's the same pathway, the urethra, that's the passage of urine from the bladder to the outside, and then the bladder, that the tube that brings semen from the testicles to the urethra and outside. Yeah. So for sexually transmitted, that's an infection that is acquired through sexual transmission. But urinary tract infection, still one can get it as an STI, but mostly it is if there is any contamination of the urinary tract, and then one gets an infection within the urinary system. That is the differentiation. What was the second question? There's something you asked, Monene, apart from that.
Yes, if
yes. I've remembered. Yeah.
Okay.
Syphilis. Yeah. Like I said, the primary syphilis is when one has a genital ulcer. One has an ulcer within the penis, within the vulvar area, the around the private parts, that persist for long. And for mostly it will appear fairly early. If one gets an infection, it takes maybe a week or so to manifest. Before that, one will not have any symptoms. And when one gets any ulcer, which is not supposed to be there anyway, any ulcer within the genital area is not normal. It should be treated as quickly as possible. One should be able to have it checked and treated as early as possible. That's the only way of preventing these things. Anything you see unusual should be, if there's an abnormal discharge, should be treated. If there is abnormal bleeding, other than the menstrual bleeding, it should be treated. If you see an ulcer in the genital area, it should be treated. If there is pain on passing urine, it should be treated quickly. Yes, if there is any swelling, around the genital areas, it should be checked and treated as early as possible. That way you prevent it from becoming complicated and causing trouble afterwards. Somebody is asking, how can you detect HPV in men? Even men can have the HPV test. Normally, they'll go to the clinic or the lab, and then a swab, smooth cotton wool, is passed around the penile scrotal area, and then it's taken for HPV analysis, and that can tell us whether one has HPV or not. And the men should be getting the vaccine, yes. Yes, the men should be getting the vaccine. It's only that we are targeting women who are more at risk, but men should get, it's the same vaccine that is given for women. For example, in Australia, they give both men and women, and their target is to eliminate this HPV infection by 2030, therefore eliminate cervical cancer by 2030. So men can get and should go for the HPV vaccine. It's not that they have to buy, they won't get the free one from the government. Okay, somebody is asking characteristics of cervical cancer and at what stage it can be treated. Well, yeah, I think it's relevant because, like we said, the cervical cancer is caused by the HPV infection. In the initial stages of cervical cancer, there are no signs or symptoms. One will not know. That is why we go for the screenings with the pap smears, and then it's analyzed in the lab. And that's why also we do the HPV screening, because it's HPV which causes these changes. So in the early stages of cervical cancer, no symptoms. Later now, when it has advanced a bit, is when one gets bleeding, especially after sex. Then one notices they are bleeding. And as it advances, it becomes frequent bleeding. They have a bad smelling vaginal discharge. They'll experience pain. And as it advances, it spreads to the rest of the body and causes a lot of trouble. Right now in our wards, especially in public hospitals, our wards are full of women with advanced cervical cancer. And cervical cancer can be treated. That is the main thing. In the early stages, stage 1 and stage 2A, we do radical hysterectomy. We remove the uterus. That includes the cervix, plus what we call lymph nodes, and that is able to treat the cervical cancer. For those where it has advanced beyond that, they are given radiotherapy. That is, radiotherapy is X-rays, which have a very high radiation, and it's directed at the area where the cancer has grown, and it's able to treat it. If it's given consistently and effectively, it is able to treat this cancer. The only difficulty are those where the cancer spread to the rest of the body, like the lungs or the liver, then it becomes very difficult to treat. But even for those with cervical cancer, it can be treated. How much is the HPV vaccine? The vaccine, there's one that goes for 4,000. It's called Savarix. That is already available in most of the private places. There's the one called Gardasil that goes for 11,000 per dose. And one needs, for adults, you need 3 doses. For children, they're given 2 doses. Yeah, so that is the cost of the HPV vaccine. Screening, that's pap smear, will take about 2,000. Right now, HPV screening is free in a good number of government facilities, like at KNH Clinic 66. HPV screening is completely free. But where in the private laboratories, it goes about 6,000 HPV screening tests. Okay.
Maybe Daktari, as we go on, I know there's a discussion that that cannot come to an end, and
Yes.
especially after the rise of the super gonorrhea, because we have a question here. But before that, the ones who are requesting for the presentation, yes, you can have it. Please write to cdm.wellness@apainsurance.org, or you call our lines. We will be able to share with you, of course, the presentations and the recordings. So back to the questions, Daktari, someone is asking, during sex, can someone be able to identify that his or her partner is having gonorrhea?
Yeah, that is very difficult unless one does a medical examination before. Yeah, but you know, all these things, that's why still the old good teaching comes in, where people are faithful to their partners, and yeah, they know each other for long, so that if one has a problem, is able to tell the other one. But by just looking at somebody, you cannot be able to tell that they have this or that. For any sexually transmitted infection or even HIV, you can't tell by just looking at somebody. Yes.
Thank you, Doc. On the chat section, Evelyn is asking, I think both men and women should be vaccinated, especially men, since they play a major role in transmitting the virus. You'll explain to that us on that. 2, what is the government and the health facilities in Kenya doing in terms of working to eliminate the HPV? Number 3, once someone is vaccinated, when someone is vaccinated for HPV, is there still a chance that they can still contract the virus? A very thoughtful question.
Yes, yes. One can still get the virus even after vaccination. The difference is the body now has enough immunity to eliminate the virus, the HPV infection very fast. That is the difference. If one has gotten the vaccine and the immunity is good, they'll eliminate the infection. So it does not prevent you getting the infection, but it facilitates the body to clear it before it causes any damage. Yeah, about eliminating the HPV virus and cervical cancer, the government is trying with awareness and provision of the initial batch of vaccines to the young girls. But it is mainly a personal and individual responsibility. I can tell you the uptake of that vaccine is about 30%. Most of it expires in the stores because people believe more in the conspiracy. People say it is wrong. It is not a good vaccine. So it is your individual responsibility. You decide, let me take my child to get this vaccine so that in future they do not get HPV infection and cervical cancer. And by giving them the vaccine, it doesn't mean you have licensed them to begin having sex. It is just education. You educate them, they are getting this vaccine to protect them in future. And even adults, it is the responsibility of each individual person to go for HPV test or pap smears, and also to go for the vaccine. It is an individual responsibility because the drugs are there. I can tell you, if you see a patient with advanced cervical cancer, they suffer so much and it's very expensive to treat. You wouldn't wish it on your worst enemy, leave alone yourself. So it's an individual responsibility. And like I said, ideally both, all of us, men and women, should get this vaccine so that we break the cycle of HPV infection. And yeah, and we know if one gets the vaccine as is required, then you have a 98% protection from getting cervical cancer. Remember, it's the consequences of HPV that are bad, not necessarily the infection itself. Yeah, so one can get either the genital warts. Now we are seeing a lot of anal warts and all that, which are treatable, but worse is those who get cervical cancer, which is expensive to treat, like we said, and we can be able to prevent through HPV screening and the cervical cancer screening tests, like I have alluded above. I know, although just as we'll answer that one, most insurances don't cover the vaccine, but they'll cover you for the screening. So the vaccine, most times, it says your individual, you take your individual responsibility and buy it. The costs compared to the long-term effects is cheap, because if one later develops cancer, then it becomes a problem. Yes.
I would say that we pride, APA Insurance prides itself in terms of ensuring that there's screening for their customers and clients. So that is a step forward for us in terms of ensuring that we do screening, and also ensuring that we do sensitization, so that at least we do prevention of these conditions. Daktari, there's a clarity one of our clients is looking for in terms of having the projection of the hepatitis A, B, and C slide, and also the causes in kids and also the teens, and what could be the possible complications for the hepatitis slide.
Okay, I think you can share with them because of time, but I'll try and project it. So like I said, hepatitis, we have hepatitis A, B, and C. And what hepatitis does, it normally affects the liver. Then if it's not treated, later on we'll have liver cancer later in life. I'm trying to get the slide. Just a minute, I try and whether it can come. Mekataa kuja. Okay, let me try. I'm almost getting it. Well, if there's any other question, we can talk as I look for the slide.
Yes, there's a question. Good morning. How can a patient go about treating and identifying UTI or STD when there is a spot during sex? I think it's a blood spot during sex, but on doing a urine test, they are told that everything is okay.
Like I said, a urine test does not necessarily screen for a sexually transmitted infection, because the urine you'll be testing for urinary infection. The correct test is a vaginal or a penile swab, which is taken to the lab. If one takes for urine, I think in 3/4 of cases, it will come out negative, even if one has got the infection.
The other one is about taking supplements like a probiotic. Is it advised if someone is having STIs or UTI to take the probiotics?
Probiotics will not help because the idea is with probiotics, you're trying to restore the normal bacterial balance. But that will not prevent you if one has sexual contact with somebody with the infection, you get the infection whether they're taking probiotics or not. The best preventive strategy is either to use protection during intercourse, the use of condoms, female and male, and the faithful to one partner. So long as one has intercourse with somebody who is infected, they get the infection irrespective of whether they are on a probiotics or not. They're not that useful. There are things people have tried, but they don't make much of a difference. Yeah, I'm sorry, I'm not able to share that, get that slide. So maybe he or she can give you their contacts, you send them the presentation. Apologies for that. Hello?
Yes, Daktari, I'm being informed. There's another question that I think we've missed.
About
is it okay to use vaginal insert boric acid suppositories to prevent BV?
Oh,
is it okay to
it is not okay. It even sounds painful. Because you are going to cause corrosions and ulcerations within the vaginal walls and create a nice environment for all sorts of infections. So do not use any chemicals within the vaginal canal. Do not use any soaps to clean inside. That makes you more liable to develop more infections because one, it reduces the vaginal acidity, which is important in preventing infections. Two, it alters the microbiome balance, the balance of the good bacteria and the fungal elements. Our bodies have a lot of good bacteria in their millions. So the moment you disturb that balance, then you put yourself up for infection. So do not use any chemicals whatsoever to put inside the vaginal canal to prevent anything. In fact, if you use, then you have somebody who has an infection, you'll get a very severe bacterial vaginosis. Yes.
There is one more question, Doc. Someone, an anonymous attendee is saying, good morning. How can a patient go about treating and identifying UTI or STD when they spot during sex, but on doing a urine test, they are told everything is okay?
Yeah, I think we answered that one. The correct test to do if one suspects they have a sexually transmitted infection is not a urine test, but a vaginal swab for the women and a penile urethral swab for men, because that is what will pick up the bacteria. Remember, the infection is not likely to be in the urine, but it will be within the vaginal canal or the male urethra for men. So the correct test should be a swab, not urinalysis. So a normal urine test does not mean one does not have an infection.
Great. Maybe, Daktari, we can get to know where we can reach you in case we have any of the alarmings. You can give us your details and where we can get you the locations, yes.
Thank you for that. So my office is at Fortis Building. Fortis Building is at Hospital Road near Kenyatta National Hospital, number 303. So Fortis Building, office number 303. Yeah, that is where I see patients privately. Yeah, and the contact is there at the top of the slide, so that if somebody wants to make a private inquiry, then you can get the correct answer. So, it's understandable some of these questions one cannot ask in public. Some are too personal. So you're most welcome to make inquiries and pay a visit to us at the clinic, and we'll be more than willing to assist.
Dr. maybe let us just answer this one, because I see there's so many questions that are coming up. Of course, we'll share with you so that you respond in confidence to our customers. And because of time, one is asking, maybe the last question, and this is for you, how much is the consultation fees? I don't know if you want to answer that in private or
yeah, okay, yeah. Our consultation is 3,000 shillings for consultation.
All right. Thank you, Daktari. At this juncture, I'll hand over to Evelyn so that at least we have a summary of what we've been discussing. And just to let you know, our audience, we usually have these webinars each end of the month. So next month, we'll be having another session. We'll be sharing with you on the respective platforms. Daktari, thank you so much for having this conversation, and I'll hand over now to Evelyn.
Thank you.
Thank you, Justus. We want to appreciate you, Doc. Thank you. That was really informative. Asante. And as much as we are saying we have so many questions, I know we'll continue answering the ones that we've not tackled. Yes. We'll just answer them. The ones that we can't, we'll direct them to you. And thank you very much. You've always come through when we ask you. We'll continue having more.
Thank you.
More sessions like these. We also want to appreciate all our clients, all our everyone who joined in. Thank you very much for having joined the session. We really appreciate everyone who joined in. We also want to appreciate my colleagues, Justus and Banis, the panelists, for making this possible. Thank you for helping through this. And I also want to finally thank the IPA management for making this possible, from medical head, the top management for making this possible. And we really hope for more. And thank you very much. I think at this juncture, we can leave at our own pleasure. Thank you, everyone.